You're watching EAC News. Thank you for joining us. The World Health Organization's representative in Cambodia, Dr. Ailan, says that the kingdom's decision to vaccinate children from 6 to 11 years old is a risk-based approach and a balanced decision. This follows the Prime Minister's launch of vaccinations for this age group last Friday, saying he was preparing for the reopening of primary schools. EAC News reporter Reo Soko has the story.
The Prime Minister launched vaccinations for children aged 6 to 11 at the Peace Palace on Friday. He says this is the royal government's decision in order to reopen primary schools after secondary schools were successfully reopened last week. No vaccination means no returning to schools. Unvaccinated students can still continue learning, but only at home. For those returning to school, vaccination cards are being checked upon arrival. Phnom Penh mother of twins, Vieri At, says at first she was hesitant about getting her 6-year-old twins vaccinated, but says it's the only way they can go back to school. Her twins, Niet Borpek and Niet Bormainong, say they're scared of needles, but are now excited to see their classmates when primary schools are allowed to reopen. The WHO's Dr. Ailan says she appreciates the kingdom's vaccination effort, which is setting a very good example in saving lives, although she says that children of this age group are more likely to experience only mild symptoms if they become infected. UNICEF says the same. In a statement released the day before the next phase of the royal government's vaccination campaign was launched, it said while evidence on COVID-19 vaccination among children is still emerging, this has to be weighed against the risk of keeping children away from school for a prolonged amount of time. The capital's primary schools have been closed now for 7 long months. Rhea Soko, EAC News.